I'd like to talk a bit about personal clinical video. This is what we're doing at RealDX. It's something we're passionate about, and it's about deepening the relationship between providers and patients. My name is Andrew Richards. I'm the co-founder and chief technology officer, and I have the distinct privilege of building all this cool stuff that you're about to see. And my partners, Bill Kelly, David Spiro, and Nick Atkins, are helping me do this, and we're all incredibly passionate about this. So we're about to flip over to something really interesting here. For most of you, when you go to the doctor, it probably looks something like this, where they're sitting around typing data into a computer. They might even look up and say hi, but they're busy, due to the technology we have right now, entering data into the EHR. And it's not their fault, it's just the way it is right now, and we want to fix that, because we've noticed there's a big disconnect between patients and providers. And there's something there that we think we can solve. And so what we decided to do was take a camera into that diagnosis environment. We wanted to see what was happening. And something amazing happened. So as we had a doctor filming a patient, just in that initial few first minutes, something really special was there. The doctor wasn't typing in a computer. They were looking at the patient. And the patient was engaging with the doctor. And all these barriers disappeared. And it was back to the way medicine used to be. And we went, wow, that's pretty spectacular. We looked at that video afterwards and we were stunned. There were all kinds of crazy things happening here. And then we thought, okay, this is a one-off thing. I mean, who really wants to be in a medical video? So then we started asking. We discovered over 90% of the patients and providers we talked to were totally happy with being filmed. We all walk around with HD cameras in our pockets right now. We don't even think about it. So why aren't we using this technology? So that's what we decided to do. So we took these videos and we said, what else can we do with them? And we built an education product. And you can see it right now. It's RealDX Education. It's totally free. You can go sign up, log in, and take a look. And we've taken these medical videos and built curated cases where we help diagnose patients and we allow med students to see it happen in asynchronous video. You can see here we've got patient information, symptoms, history, all of that cool stuff. And as we started using this, more and more people got interested in us. And now we have all these partners, and things are taking off. A month ago, we got mentioned at TEDMed and presented about our new technology because of our new partnership with a group called NextGenU. And what are we going to do with these guys? We're going to use the technology of RealDX and NextGenU to train 10,000 doctors in Sudan in the next 5 years. The country has almost no doctors, and thanks to medical video, we're going to help fix that. So then we said, what's beyond education? Education is a small part, a valuable part, but there's more. So we thought, medical video, they can do so many things with this. But what if we distilled it down? What's the basic functionality that we need to capture here? And we figured out it's 3 simple things: capture, store, and share. And if we can do that simply and securely and meet HIPAA compliance and all these other regulations, we can deliver a really cool solution. And once we did that, we went, okay, what kind of use cases fit this? We couldn't keep up with them. Things like asynchronous store and forward, the ability to film a sick patient and send it to a doctor and they can watch it when they have time. The ability for an EMT to capture the scene of an accident and have it waiting for the doctor when the patient gets there. The ability for someone to shoot a video and share it with their care team when they're fighting a major disease. This is bigger than us. There are so many uses for video. Us at RealDX realized we can't do this. So we said, instead of trying to solve all of these problems, why don't we build a toolbox and have you help us? So that's what we decided to do. So we are now taking the technology we've built for the medical education product and we're opening it up. We're building a RESTful state API. We're providing the tools for integration into major providers, single sign-on, all that cool stuff. We're opening it up because we want anybody that has a cool creative use for medical video to leverage our tool set. We're going to be the toolbox. You guys get to be creative. And we're going to still build apps and we're still going to support this, but we want this to blow up. We want to let this happen because, again, this is bigger than we are. So I encourage you to notice that video is now bridging the gap. This isn't the future, this is happening today. Because when that barrier breaks down and patients want it and providers want it, which they already do, we're there. So come check us out. Come look at RealDX. Come look at what we're doing, and help us. We're giving this away. We want you to be part of it. And we need that creativity. There's all of these amazing ideas that you have. We want to enable you to use them.